Today we will talk about general anesthesia, that medical magic that puts you to sleep but without fairy tales. And no, you will not wake up speaking another language, even though some viral stories on the internet say otherwise. General anesthesia temporarily turns off your consciousness, blocks pain, and relaxes your muscles. Basically, your body goes into airplane mode while the surgeons do their job. There are different effects that anesthesia produces post-operatively or post-extubation when the patient wakes up. Nausea and vomiting. This is one of the most common side effects. It occurs because anesthesia can affect the digestive system and the vomiting center in the brain. To reduce the risk, medications can be administered before and after surgery. These include the administration of general anesthesia, the use of opioids, and personal factors such as female sex, a previous history of post-operative nausea and vomiting, and not being a smoker. These symptoms are common, affecting more than 30% of people after an operation. Also, certain types of surgery, such as abdominal surgery, plastic surgery, and eye muscle repair, increase the likelihood of nausea and vomiting. 2. Dizziness and confusion. After anesthesia, it's normal to feel a little disoriented or confused. This is because it takes a while for the brain to regain normal activity. In older people, this effect may last longer. Anesthetic medications can affect the brain and nervous system, causing disorientation, drowsiness, and dizziness as the body removes them. Not eating or drinking before surgery, along with losing fluids during the procedure, can cause dizziness. 3. Chills and shivering. Many people feel cold after surgery. This happens because anesthesia can cause body temperature to drop slightly. It is temporary and is usually resolved with thermal blankets. They may be related to the anesthesia used during surgery, which can cause dilation of peripheral blood vessels, leading to heat loss and therefore a response by the body to regain body temperature, such as shivering and chills. 42. In addition, body temperature may decrease during the surgical procedure, which can lead to the body generating shivering to try to increase heat production and maintain body temperature within an optimal range. It is also possible that shivering is due to the release of cytokines by the surgical procedure, which can cause an inflammatory response that includes shivering. In addition, general anesthesia can cause a decrease in the body's core temperature, which can lead to shivering as a response to increased heat production. It is important to note that post-operative shivering is generally self-limiting and does not become chronic, and although it can be bothersome, it does not usually lead to serious consequences. However, if the tremors persist or are accompanied by other symptoms such as fever, it is important to inform the medical team to rule out any possible infection or complication. 4. Sore throat. If an endotracheal tube was used to help you breathe, you may feel irritation or sore throat after surgery. This discomfort goes away in a day or two and can be relieved with warm liquids or mild painkillers. 5. Muscle pain. Some people feel pain in their muscles after anesthesia, especially if muscle relaxants were used during surgery. This is temporary and is managed with mild painkillers. 6. Feeling tired. It is normal to feel sleepy after anesthesia. The body needs time to eliminate the medications and fully recover. Therefore, after surgery, it is recommended to rest and avoid activities that require concentration, such as driving. But don't worry, these effects are temporary, and the medical team is there to make sure everything returns to normal. So if you're going to have surgery, don't worry. You won't wake up in another century or turned into a different human being, so relax. Have you ever had surgery? Tell me about your experience in the comments, and don't forget to subscribe for more information about anesthesia and health.